Hi class, this is my flashcard presentation on aortic aneurysm or aneurysmal disease. It's a process involving the degeneration of the arterial wall. And the degeneration is a result of increased elastioplasis, which then leads to dilation of that blood vessel and collagen failure, which often precedes a possible dissection. So the pathophysiology is an aneurysm is localized dilation and weakening of the arterial wall, with the most common locations either being in the abdominal or thoracic aorta. So the weakened area presents sometimes as different shapes. A saccular shape is like a bulging wall on one side, and a fusiform is circumferential, which is a enlarging along an entire section of the artery. If the aneurysm is dissecting, this is when there's a tear in the intima, which allows blood to leak along the vessel between the layers of the arterial wall. Aneurysms begin as a defect in the medial layer of the artery and are often due to turbulent blood flow at a bifurcation. And many aneurysms eventually rupture, causing massive hemorrhage, which often leads to death. The most common risk is atherosclerosis, or hardening of the artery, that can be also complicated by hypertension, as high blood pressure is present in almost 50% of the patients diagnosed with an aortic aneurysm. Trauma, such as a car accident, infections like syphilis, and congenital defects. In 2019, about 59% of deaths due to aortic aneurysm or aortic dissection happen among men, so gender is a factor. And there are known increased risks with atherosclerosis from smoking, which may lead to an aortic aneurysm. Major signs and symptoms. Many times the aortic aneurysms go undetected and patients remain asymptomatic for a long period of time. There are incidental findings on routine CAT scans. For other illnesses is often how they're originally located. And many patients aren't aware that there's an issue until the aneurysm becomes very large or may rupture. Depending on the location of the aneurysm, patients often present with different symptoms. So an abdominal aortic aneurysm, or AAA, that patient may have nausea, vomiting, some lightheadedness. A thoracic aortic aneurysm, or a TAA, may present with chest discomfort or dysphagia related to the enlarged aorta actually putting pressure on the esophagus. And also spinal pain, which is related to pressure on the nerve. There's a picture showing the enlarging of the aorta there. It's found with diagnostic testing. The US Preventative Task Force recommends screening with an ultrasound, CAT scan, or MRI. And there are my references. Thanks.